Hello, my name is Brianna Carlin. I am presenting to you a PowerPoint on advocating the reduction in postpartum morbidity and mortality that comes along with childbirth. I am very, very passionate about this subject as I am a NICU nurse. I've been a NICU nurse for 6 years. And in we think that, oh, sick babies, we have to take care of them. But where does that start? Where do we get the sick babies? I believe that a lot of this could be avoided if we only had more policies and procedures regarding postpartum treatment of mothers, any kind of perinatal. So, what can we do to reduce the postpartum morbidity and mortality of our pregnant women? So, the majority of maternal death occurs in the postpartum period due to preventable medical complications and persistent racial disparities in care, access, and quality. This subject is so very important in the healthcare system as most of these issues and complications are preventable if there are good policies and procedures in place. This is important to leaders as they can play a crucial role in improvements in these statistics. So it's a call to action. This slide will it's outlining the central problem statement regarding postpartum morbidity and mortality. It highlights the urgency of implementing safer maternal health practices and the importance of ongoing postpartum care and monitoring. We need to raise awareness of risks and prevention strategies alongside advocating healthcare improvements and patient education, which is vital. Supporting mothers through evidence-based interventions can significantly reduce postpartum complications and mortality. This is showing the importance of raising awareness about postpartum risks and prevention strategies. Early follow-up visits. We need to see these mothers sooner. We need to see them sooner than 1, 2 weeks even, really. We need to be making sure that we are out there and keeping up with them. A really big one would be educating the mothers and improving the healthcare services which are available to them. That's critical reducing further complications. Evidence-based interventions play a key role in supporting the maternal recovery and ensuring safer postpartum experiences. This can be done through your community doulas, the home visits after they give birth. If you've got a new mom, how is it that she's going to load up 2 toddlers and a newborn? We need to get them access. That can even be through telehealth. We need to lay eyes on these mothers and let them know they're not alone. Postpartum depression, the preeclampsia after delivery is huge, and we need to be catching these things because they are avoidable if caught early. So we need to use our leadership skills, empathy, and listening to postpartum patients' fears and symptoms with compassion, humanize care for all mothers, develop mentor providers and community workers, and nurture the continuous learning in a safe postpartum practice. We need to make sure that people know what they're doing. People know what services they need to be offering to these mothers. Positivity will inspire hope and trust in the care systems, and it'll energize teams in tackling maternal health challenges. Harmony builds collaboration between OB, emergency mental health, and community teams to reduce care gaps. An includer of leadership would ensure underserved, at risk, and minority women are heard, respected, and centered in care solutions. Having these leadership skills is good. Having these leadership strengths need to be also part of a team. So you can have other people's leadership strengths to make the best care plans you can for these women. Some great key legislative efforts that are out there right now are as follows, and you can see them here on this slide. If we don't make this a fuss, if people don't talk about it, how does change happen? How do we make change happen? It's getting it out there. It's getting the word out there. So several important bills are currently under review. The Momnibus Act is a comprehensive package addressing systemic inequalities and expanding maternal care to underserved communities. The Medicaid postpartum extension is already being adopted in what I found 48 states, which is huge. This extends healthcare coverage to 12 months after delivery instead of cutting it off at 60 days. This is huge for mothers as they are able to take that time after they deliver and be followed for 12 months. You may not catch preeclampsia in the first 60 days. You may not catch postpartum depression in the first 60 days. These things can be caught if we just expand coverage. The Healthy Moms and Babies Act focuses on requiring insurers to fully cover prenatal to postpartum services, including mental health, with no out-of-pocket costs. This one in itself sings to my heart. I feel as if this bill could help in so many avenues as, people don't have these options. Then it's going to be, though, on the other side, who's going to pay for this? So uh, it's definitely something to think about. Senate Bill 1004 would reauthorize vital treatment programs for pregnant and postpartum women struggling with substance use. This is also huge. These women who are addicted to drugs are more prone to have postpartum complications, including postpartum hemorrhage, high blood pressure, even prior to in the prenatal phase. These women need the help they can get to have a healthy pregnancy or as healthy as they can get. The policies are not just legislative wins, they will and are life-saving measures. Extending postpartum coverage means mothers can access care for delayed complications like hypertension, depression, and cardiomyopathy. They target the women most at risk, especially the Black, Indigenous, and rural mothers who have long faced systemic barriers to care. These laws help build strong maternal care systems by funding community programs, improving insurance access, and ensuring continuity of care. In short, the legislation plays a powerful role in preventing maternal deaths. This can only be done by leaders in this profession. So, in order to keep advocating and helping mothers and children, influencing others will be important across the policymakers worldwide. Institutional based, a leader can join hospital safety and quality boards to improve postpartum protocols. They can stay with these code whites. They can make step-by-step procedures to say, hey, if this happens, we can fix it. We know what to do. It won't be a shock. At a at an at a local level, leaders can partner with public health departments to support doula and home visit programs. At a state level, leaders can serve on maternal mortality review or Medicaid advisory committees. This will help see the numbers. We can see the numbers to be able to present these policies. Regionally, leaders can collaborate with perinatal quality collaboratives to scale best practices, to engage on a national level with the CDC, and then internationally participate in WHO and UN task forces to influence global maternal health strategy. We live in America where we are very, very lucky. We have these things available to us. Other mothers are struggling in third world countries to even get seen in a clinic. So we can get together with these organizations, with the WHO and UN, and we can see what we're doing right and what we need to improve on, and we can share those with other leadership people around the world. In order to take point with these policymakers, the use of emotional intelligence can be very important. You need to lean on that connection that will help make this issue somewhat personal to the policymakers. For example, presenting a real life scenario, a story about a patient who died from untreated postpartum hypertension due to a 60-day Medicaid cutoff. We should follow them for longer. This allows to humanize the issue, stay grounded under pressure, and build influence through relationships and combine empathy with data for a lasting impact on these policymakers. So, how do we change this? What do we do? So, looking into the change theory, this slide presents the Deming's plan, do, check, and act cycle, which applies to making a policy. So, in regards to reducing postpartum morbidity and mortality, have a plan to identify key causes of maternal death. For example, the hemorrhage or a lack of follow up after the patient is discharged from the hospital with that baby. Draft a policy or program to help this. What kind of program can we enact to follow up with these mothers once they go home? This can include designing a program and draft supporting policies based on data showing postpartum risks after the 60 days. What are we seeing out there that's coming up? Then we will include a pilot of the program in select hospitals or states with Medicaid extension and care teams. To check this, leaders can evaluate health outcomes, readmission rates, and patient satisfaction. Then we act. Using the pilot program, if it's successful or even if it's not, we will refine the program, expanding to more states and push for the national legislation. And we will continue this cycle over and over again until we see improvement or we see what we can improve. So, in conclusion, improving postpartum outcomes demands a multifaceted approach combining clinical excellence, policy action, and inclusive leadership. By embracing standardized care, fostering cross-disciplinary collaboration, and advocating for supportive legislation, we can significantly reduce morbidity and mortality. Continuous evaluation and empathy-driven care remain key to sustaining these improvements and addressing disparities in maternal health. Thank you so much for taking your time to listen to my presentation. I hope that this has educated you on the things that are surrounding all things moms, all things babies. These are things that we can prevent, hopefully, and services that need to be presented to mothers and families alike. Thank you so much again for listening.